Welcome back. Well, tomorrow is National Lung Cancer Screening Day. Lung cancer, it's the leading cause of cancer death in both men and women, and our region sees its fair share of cases. But there are some things that we can do to stay healthy, and now I am joined by Dr. Ricardo Siller. He's a surgeon with SIH. Welcome to our show today, doctor.
Thank you for having me, Rachel.
Oh, it's our pleasure. We like to bring in an expert to talk about something like this, especially as we are starting to head into the months where we really have to think about, well, our upper respiratory system. So we'll get started with, so you are a cardiothoracic surgeon? Did I get that right?
Yes, cardiothoracic surgeon.
There we go. Okay. So how does your work tie into lung care?
Well, cardiothoracic surgeons, we take care of diseases and conditions of the thoracic cavity. That is the area from the diaphragm up and covered by the skeleton, the sternum, the scapula, and the ribs. And all the organs that are contained in this cavity are treated by the cardiothoracic surgeons. So one of the organs is the lung, so we treat the lung as well as the heart, like coronary artery disease and valve disease.
Okay.
Yeah.
Well, I'm glad that you explained that because I wasn't sure entirely what that, included. So thank you. I mean, obviously, I couldn't even exactly, say it out there correctly. Well, Southern Illinois has higher rates of lung cancer compared to other state and national averages. Do you happen to have an inkling as to why that might be?
Well, as you said, it's true. It's a little bit slightly higher incidence, and that can be tied due to smoking. Smoking is the main risk factor for lung cancer, so the rates are high in our area. Also, because of the industries that of the area, like coal mining, and also agriculture, and also because it's a genetic condition too that can be inherited. So it's a multifactorial disease and has these all causes.
Sure. Well, that makes a lot of sense too, because we are in a rural area. Like you said, our industries around here, I mean, we are breathing in what we're working on, and that definitely is going to have an impact.
Exactly.
Sure. And I'm sorry, I think I interrupted you a little bit.
No, I was just going to say that, yeah, so nationally, the incidence of lung cancer is about 55 per 100,000 people.
Okay.
And here we go all the way up to 65 to 70 people per 100,000.
Wow, that seems like a significant increase for our area.
Correctly. Now, lung cancer is also the main cause of death from cancer.
Okay.
So it's about 125,000 per year in the country.
Yeah.
And that, compared to other types of cancer, is very elevated.
Wow. Yeah, absolutely. That's significant. And we want to make sure that we are on top of that. Yes. And that kind of brings me to our next question. Now, one of the best tools that we have for early detection is a low-dose CT scan. Can you tell me about that, what that is?
Exactly. So technology has evolved to be able to do a CAT scan with very low dose radiation. And which will not cause any problems, is painless, and it can detect early lung cancer. Now, mortality from lung cancer is tied to the stage. So if you find it at stage 1, you have about 80 to 85% possibilities of being completely cured.
Okay.
If you catch it at a higher stage, those possibilities start dropping. So the CT scan is indicated, the low-dose CT scan is covered by insurance, and it's indicated in people from 50 to 77-year-old that smoke, that currently smoke, or that have smoked in the last 15 years.
Okay.
So this study is revolutionizing the care because it can find the cancer very early.
Sure. Well, and that's fantastic. We've got about 30 seconds left in our interview, doctor, but you can get care for that right here in Southern Illinois, correct?
Exactly. So SIH has invested in a cancer center. We have state-of-the-art facilities. We have the highest technology to diagnose, ion bronchoscopy, and Da Vinci robotic minimally invasive surgery.
The Da Vinci machine, I remember that.
Right. So that lowers the pain, the stay in the hospital, and it gives you a more precise surgery.
All right. So the important note and takeaway from this is that screening is pretty imperative to making sure that your upper respiratory health stays where it needs to be.
Exactly. So the most important message is that to do the CT scan early. You can call SIH. We have different centers, and you can get it covered by your insurance and a very quick exam.
All right.
Yeah.
Doctor, thank you for coming and talking
Thank you.
about
You're
the
welcome.
importance of prevention, especially ahead of, well, flu season, pneumonia season. We've got so many things that impact our upper respiratory. Thanks for coming in today.
Thank you. I appreciate it.
Of course.